My name is Scott Vincent, originally from York, Nebraska. I did my undergraduate training at the University of Nebraska-Kearney in Kearney, Nebraska, and then ended up coming here to Omaha at the University of Nebraska Medical Center to do my medical school, and stayed in Omaha for my orthopedic training, did my orthopedic surgery residency here at UNMC, and then ultimately went on to the University of Wisconsin for a one-year fellowship in adult spine surgery. My specialty is treatment of disorders of the spine, and that's everything from the base of the skull down to the pelvis, so that the cervical, thoracic, and lumbar spine. We treat common degenerative conditions of the entire spine, whether that's degenerative arthritis, spinal stenosis, disc herniations. Those are all very common problems we treat. We also one specific interest of mine is spine trauma and spinal cord injuries. We treat those as well. And then also tumors of the spine, spinal deformities, anything involving the spine is my area of clinical and research interest, and will be the kinds of problems and patients that I'll be seeing on a daily basis. So for me, it's important to get to know someone. Really, I try and focus on what it is about their problem or why they're here, and what it is that I can specifically do to make that problem better. And part of that is determining how a said problem affects them on a daily basis. How does it affect them at home? How does it affect them at work? And what does it prevent them from doing? All of those things I try and learn very quickly in our interview, and ultimately try and tailor our treatment decisions in answering those questions. What are ways that we can get people back to work? What are ways we can get them back to doing the things that they enjoy doing at home? And what are the things we can do to just make them feel better on a daily basis? So I think getting to know someone very early in the visit and what their goals are and what bothers them, and then ultimately what their goals are in getting better, and then try and mold our treatments to what their expectations and what their desires are from their encounter with me. Going through medical school, I really enjoyed everything that I did, but for me, orthopedics stood out both because of the ability to affect people's daily lives in both the clinical and surgical setting. We were able to take musculoskeletal problems, make them better both surgically and non-surgically. I enjoyed my time with patients both in the clinic and the operating room. And specifically, as I went through my training, I really enjoyed working with patients with spinal problems, and so ultimately went on to do a spine fellowship. I like the idea I could help patients of all ages, everything from neck problems to low back problems, and kind of the intricacies of the spine and the nerves, and being able to treat spinal problems both surgically and non-surgically was really appealing to me and very interesting to me.